Tonight, after 6 deaths at Seattle Children's Hospital, King County is changing the way cases of Aspergillus are reported. Good evening, I'm Monique Minglavin.
I'm Steve Rabel. This comes days after the hospital revealed the problem with mold. They go all the way back to 2001. KIRO 7's Dee Dee Sun is live at the hospital, and Dee Dee, parents are still trying to figure out what to do next.
I talked with a mom in Puyallup whose daughter needs surgery, and here's a few photos of her daughter. This one, she's actually at Children's Hospital. Now, that surgery has been postponed until December because of the mold problem here. But that mom tells me she's worried bringing her daughter back here for the surgery would mean risking her daughter's life. 8-year-old Desiree Smith has sleep apnea, among other health problems, and needs surgery.
Her oxygen actually cuts off when she does lay down to sleep.
She was supposed to get that surgery in a few days. Then yesterday, her mom got a call
Telling us that it was rescheduled for December 7th on a Saturday due to the air quality, is what they called it.
She said Children's Hospital did not mention the Aspergillus mold problem or the people getting sick or the cases where 6 patients have died.
We've been there twice a month for, over the last year, and we've never been told about it until it hit the news. And they should be more concerned with the children first rather than the hospital itself and their reputation.
She and other parents have reached out to KIRO 7 asking what is Children's Hospital doing to fix the problem and how are health officials making sure that happens. I took their concerns to King County and Seattle Public Health, which is working with Children's, the State Department of Health, and the CDC on this case. What insight do you have on what the hospital can do to make their environment safe again?
They will now be taking some of the most extensive protective measures for their patients.
He says measures include special HEPA filters in every operating room and a new air handling system. But public health says there is a big challenge.
In the context of Aspergillus, what I wanted to communicate to you is very little is known. This is a rare infection, first of all, and there are very little hospital outbreaks like this one from which we can learn.
And because the mold is so common, it's impossible to get the risk down to zero. Children's Hospital said in a statement today, "We are committed to an appropriate and timely resolution," and said its CEO is developing a comprehensive systems improvement plan, but did not give a specific timeline. Jennifer says she plans to change hospitals.
Starting over is better than a risk of losing my daughter.
As for changes on how Aspergillus is reported, right now it's only required from a healthcare facility when there is an outbreak. But King County says right now they recognize that even cases that seem entirely separate, as with some of the cases here at Children's, they realize now could be connected. And so starting early next year, they want to start requiring healthcare facilities to report any Aspergillus infection case. Live in Seattle, Dee Dee Sun, KIRO 7 News.